at the University of Montana School of Physical Therapy and Rehab Science in the Vestibular Research Lab. Her site mentor is Brian Lloyd, and the name of Erika's presentation is Comprehensive Community Education Program for Vestibular Rehabilitation. So Erika, if you want to share your screen, you can take it away. While Erika's loading her screen, I'll just comment that we are going to hold Q&A. You can put questions in the chat if you want, but we're going to hold Q&A to the very end. So go ahead and put those questions in the chat if you have something pressing that you worried you might not remember by the end. So go ahead, Erika, take it away.
Okay, perfect. Can everyone see my screen?
Yeah, it looks great, Erika.
Awesome, thank you. All right, so my name's Erika Neutzel. My project is called a Comprehensive Community Education Program for Vestibular Rehabilitation. I did my site was the University of Montana Camp Lab, which stands for Community Ambulation, Mobility, and Participation. And that's run by one of my professors and a researcher at the University of Montana, Brian Lloyd. And let's see. I don't know if you guys can see the video like everyone else's windows, but it's blocking some of my text. Is that the case for you?
We can see your slides just fine.
Okay, perfect.
Yeah.
So I'll just start with a little bit of background about dizziness and imbalance. And vertigo, or true dizziness, is the sensation of room spinning around a person. It's often caused by specific head movements that can lead to imbalance, dizziness, nausea, and blurred vision. And these bouts can last for a long time. They may be sudden, they can be intense, and sometimes they happen overnight without any warning. A lot of people that experience vestibular dysfunction also have anxiety and fear, maybe even hearing changes or cognitive issues associated. I've got some statistics over here that are important. I think the most important one is the second bullet point, that almost, over 2.5 million people in the US visit the emergency room every year for dizziness. In addition to that, dizziness can lead to increased risk of falling during acute events, restricted activities, lost days of work, decreased quality of life, and it's often misdiagnosed by primary care physicians. So the goal of my project is to improve community education around physical therapy as a first-line defense or treatment option for vestibular rehab. All right, so Montana is a direct access state. And so what that means is no referral from your primary care physician is needed to seek care from a physical therapist. This is important because it means that patients are able to streamline their treatment, avoid delays and from the referral process, and then find relief from their symptoms quickly. This leads to a better prognosis, as early diagnosis and treatment can prevent an acute bout of dizziness from evolving into a chronic condition. I've got a graph here from the US Census Bureau Quick Facts page that looks at the insurance coverage demographics in Missoula, Montana. The important thing that I want to highlight here is that the overwhelming majority of Missoulians have employer subsidized health insurance. That's important because it means that there's really no restriction or barrier for seeking physical therapy as direct access. If you look lower, this third line down and fourth, Medicaid and Medicare often require primary care referral for physical therapy care. And that's an important distinction to make, especially as many of our aging population rely on Medicare health insurance. But the thing to note is that everybody that has either Medicaid or Medicare also is required to have a passport to health account, and that it's very easy to seek a referral either over the phone or through a quick message on that passport to health program that can, again, reduce delays and increase the speed of seeking treatment through physical therapy. The competencies that I covered have a lot to do with interpreting data. That was mostly to kind of figure out and looking at the research to figure out the best pathways for education and how to reach out to people who don't know that physical therapy is a great first option for dealing with dizziness, whether that dizziness has to do with a common PT condition that can be treated, or if they can be, need to be screened and referred out. I think the biggest gap is that there's just a lack of knowledge of what resources are available to treat such a common symptom. So I created a flyer to kind of share the results of that data. And then the rest of my competencies have a lot to do with communication strategies for different audiences and sectors, communicating audience-appropriate public health content. And then, again, looking at demographic characteristics in Missoula to identify, age, sex, insurance coverage, and the best pathway to communicate this public health knowledge with the general public. So my first product is a postcard, and I've got the front and the back shown here. I created just like a little kind of scribble that I ended up using a lot in my other products, because I just felt like it was kind of a nice abstract representation of what dizziness can be like. There's a quick note on the back about, what is dizziness, and that people that experience dizziness are not alone. It's very common, and just trying to increase awareness about direct access, and specifically the UMPT Vestibular Rehab Clinic to seek treatment for their symptoms. This would be mailed out to the 59801 and 02 zip codes, and I chose to do a postcard because of research about communicating and educating the aging population. Many older folks still rely on hard copy, mail to receive information, and like to have, from what I could tell, like to have something to hold on to refer to. So that's what this would be sent directly to the homes of people living in those zip codes. My next product I created was an informational flyer, and this has a lot more data and analysis on the flyer. So the idea is, again, to kind of take this information a step further and present some statistics about how common dizziness is. The goal is that this flyer would be presented in both on campus in the camp lab and the UMPT clinic, but also at St. Pat's in the emergency room, because 50% of because so many people visit the emergency room when they experience dizziness. So really trying to increase public education about how the emergency room might not be the most direct or the best way to access care to treat their symptoms. And then also same line of thinking goes along with posting this flyer in local urgent care centers. Over here, I just have a little map of all of the urgent care centers that are available in Missoula. And then down on the bottom corner, I have a QR code that would take anybody that scanned it to my next product, which is the Vestibular Rehab website, which I'm going to try to link to now. Great. So this is the first page. It's just kind of a basic website that, again, makes this information a little bit more accessible from anywhere and tries to create just another route of education for vestibular rehab. So I've got a quick blurb on what the vestibular system is, common causes. Not all of these are treatable by physical therapy, but the point I wanted to make here is that PTs are the best suited healthcare providers to be able to diagnose the cause of dizziness, refer somebody that they, to the care that they need, or treat those symptoms if they do fall into treatment categories for PT. Those categories, I've got these two categories down here, very common, benign paroxysmal positional vertigo and vestibular hypofunction. This page just has a lot of that same information about what it means to have direct access in your state and why that's important for seeking care through physical therapy. This page is just a little bit more information on those two very common PT diagnoses of dizziness. And then this is what people can expect with vestibular rehab, which I think is something that a lot of people that have never experienced dizziness before can have a lot of anxiety, fear, apprehension around the dizziness, and certainly around what would go into treating the dizziness. So the goal here is to try to calm some of that apprehension. And then the last is just connect with our vestibular PTs. Okay. So facilitators, I think that having the residency program through the family medical residency program through that's hosted at Providence St. Pat's would be a really huge facilitator to implementing this information, both for community education and also to educate other healthcare providers that PT is a viable option and, in fact, the best option to treat dizziness. Insurance coverage, like I mentioned with that graph earlier, is another facilitator, just because so many Missoulians have the type of insurance that don't require referral. The PT clinic was a big logistical facilitator for me. I was able to talk with providers, seek feedback. I also got feedback on particularly my flyer from my PT cohort, as well as I think it's the third year pharmacy cohort, which was really helpful because I think a lot of the time some of that statistical information can be a little bit jargony. So kind of redefining and taking a lot of that feedback into account and helped me create, I think, a flyer that's a little bit more approachable. The camp lab was a great place to learn all about vestibular, rehabilitation, and had a lot of resources as far as, Brian goes, seeking feedback again, getting advice, a good place to work as well. I also was really surprised by Canva as a website. Was really easy to use to create my my products. So I really enjoyed that. It helped kind of streamline my design, and it was easy to upload some of my personal designs and whatnot. And then just my education in my PT program, understanding what vestibular dizziness and imbalance is. Some of the barriers were that it's just difficult to get your foot in the door at some of these urgent care centers and primary care offices. And then also just educational strategies in general for vestibular physical therapy there's not a huge body of research about how to communicate with the public, and even less evidence for what works specifically with the older population. And, dizziness and imbalance, just like any other kind of diagnosis, is, risk increases with age. So certainly the aging population would be the biggest target for my community education program. And so, like I said, Canva, it actually made it really easy to design a website, which I was surprised by. And then I found that once I started telling people about what I was working on for my project, there were a lot of folks in the community, including my family, friends, patients I'd been working with, that didn't realize that physical therapy treats, vestibular dizziness and imbalance. We're really surprised by that. So I guess it was affirming in my decision to pursue this for my capstone project, because it definitely felt like there was a need that I could address. And then this is my professional service. I spent a week over the summer. These pictures under Empower Spinal Cord Injury. I spent a week with them over the summer, last summer. It's a week-long spinal cord injury kind of sleepaway camp that's hosted at the University of Montana that has, very specialized activities, physical therapy, occupational therapy, three times a day, and offers a lot of like community support and resource sharing and building for individuals that have a spinal cord injury. So we went out to Placid Lake, and we can see like here an adapted paddleboard that has a wheelchair anchored onto it, some adaptive cycling, and then something I've always been involved with and that kind of led me to pursue grad school for PT and public health was that I love adaptive recreation. So I was surprised when I came to Missoula that there wasn't already a program here. Eagle Mount in Bozeman is super popular out there. There's Dream Adaptive up in Whitefish, but there was nothing in Missoula. So this summer, the timing was just right. And I was able to connect with a really awesome group of people that had a ton of energy to get a new nonprofit off the ground. So I co-founded Missoula Adaptive Recreation and Sports. We go by Mars for short. And this winter is our first season of adaptive programming. We're offering sled hockey, which you can see here, which is adapted hockey. We're doing fundraisers and really just trying to build our network this winter as we prepare for our first summer season coming in spring of 2024. And that is all.
Thanks, Erika. Thanks so much. Our next guest speaker is going to be